Thank you, Judge Hidalgo and Mayor Turner, for letting me speak today. And I'd like to recognize Director Robinson from Harris County Public Health and Emergency Management Coordinator Mark Sloan, partners in, not in crime, but in hoping to improve the situation of this community. So a number of things that the Mayor referred to that we talked about. And so I said yesterday at a press conference with the Mayor, and I'm going to repeat it again today, and if you are currently unvaccinated in this community, you represent a danger to yourself and others, and in particular your own family members. Now, let me explain what I mean by that. Both the mayor and the judge have referred to the situation of our healthcare system. The healthcare system right now is nearly at a breaking point. The hospitalizations, if you go to the web pages, and the TMC has their web page, and I also would ask you to look at setrac.org, setrac.org, and that's an interactive web page. And you can look at what's happening to the number of patients that are being admitted to hospitals. The mayor pointed out that in the last 24 hours, over 300 new COVID patients were admitted to hospitals in the Texas Medical Center. That is a 500% increase from a month ago. 500% increase. And when you look at the number of new cases that we've in the community, it is 2,500% than it was a month ago. So think about that for just a moment. If the number of cases have gone up 25% or 2,500%, hospitalizations are going to lag behind that. And they're up 500%. So what's it going to be next week? To reinforce that, when you look at the viral load in the wastewater, we picked July 6, 2020, which was the peak of the first wave since we had the wastewater testing. At that peak, that was arbitrarily set at 100%. That was in July 6, 2020. In January, the next wave, we peaked at 250%. 2 weeks ago, we were at 231%. And last week, we were at 320%. The positivity rate by about 2 weeks the wastewater activity by about 2 weeks predicts what we're going to see in positivity rate, which the judge pointed out has skyrocketed. So the wastewater is still going up. And the positivity rate projects what happens about 2 weeks later in hospitalizations, which are already skyrocketing. So for the next 3 weeks or so, I see no relief on what's happening in the emergency department. So what does that mean? Let's make this a little bit more tangible. As we started, I pulled out my phone, I looked at a data source that I've got, and as we started this conference at 1 o'clock in the afternoon, the Houston Fire Department, which has 104 ambulances, 26 of them were in hospital emergency departments waiting to offload patients. 4 of them had been there for over 2 hours. An ambulance that's in the emergency department waiting to offload a patient is not available to take the next 911 call. Response time up, I fear, and I don't want to be a fearmonger, and I don't want to be accused of that, but I'm afraid for the fire department when we get to the point where too many of our ambulances are in emergency departments waiting to offload patients because there's no beds available, and people are calling 911, and we're going to either have a prolonged response time or perhaps none at all. That is foreseeable based on the numbers that I just gave you. We should be able to see that occurring. And the best way out of this is for people to get vaccinated. And when we look at the hospitalizations, depending on which hospital you talk to, between 85 and 95% of the COVID patients that are in the hospital are unvaccinated. We know that 99.97% of the deaths since January, the COVID deaths in Harris County, were among unvaccinated people. So we've got to do this. And let me remind you of something else. We're talking and we're focusing a lot on COVID patients. You know what's still going on in the community? Heart attacks, strokes, motor vehicle accidents. We've already had to deal with patients that we're trying to find a hospital that can take somebody, not even a COVID patient, just somebody with what would normally routinely happen, and there are no beds available. That's why we've got ambulances waiting for hours and hours to offload. And in addition, the mayor pointed out, one of my other hats, I work with SETRAC, and we help facilitate difficult transfers. This weekend, we transferred a patient from the Houston area, do not fall out of your chairs, to North Dakota. I have a family member, my own family member, who was ill in Livingston. The closest bed they could find for him was Austin. And then when they got into the detail about how sick he was, we said, we can't handle that. He's too sick. You know where he is now? He's in Shreveport, Louisiana. So it is real, and it is happening now. The way out of this is vaccination. I apologize if I sound alarmist, but in my world, wearing my EMS hat, the crisis is occurring. People out there in their homes who feel fine, you may not be able to see it, but if you have a heart attack, or you break your ankle falling down the stairs, It may take a long time to get an ambulance to you, and we're going to have a hard time finding a hospital that's going to be able to take care of you. Thank you.
One question for me, and one from the pool as well. It's keeping on what you're seeing with the wastewater and how bad it could be in a couple of weeks. Are the city and county health departments working with local hospitals on a plan for beds and personnel? And if so, what does that look like right now?
So we have been. And actually, you know, the county took the lead on getting resources to have the thing that we had out at NRG for a while. Thank God we didn't need it. So there is talk about how to do it. But our problem today is the nursing shortage, quite honestly. In fact, we have hospitals in the region that they've got physical beds, but they don't have the nurses to staff them. We have other hospitals that have taken the recovery room and clinics and converted them into patient rooms because they were able to find nurses to do it. So all the hospitals are pulling out all the stops. But if we look at an alternate care site, a field hospital, whatever you want to call it, right now our rate limiting step appears to be nursing, quite honestly. And I'll tell you what, right after that is going to be physician staffing and respiratory therapists. But right now it's the nursing shortage, which is preventing us from being able to do something like that. We are talking. They are desperate for something like that to contribute.
One more question from the pool. Will you continue to monitor COVID-19 through wastewater? Can this testing trace which variant is most present and where? And then another station wanted to know specifically about the Delta Plus variant. Yeah. Are you seeing it?
Yeah, so not a big surprise. We do look at that, and it's almost entirely a Delta variant, and it's everywhere. So, okay.
Judge Hidalgo, if I may